My name's Scott Donohoe. I've been Branch Health and Safety Officer with the Unison Glasgow City branch for about 14 years. Our membership base within the branch is just over 11,000, mainly in local authority, Glasgow City Council. The situation with the SECC complex is owned 91% by Glasgow City Council. There was a gas leak at the complex in November 2013. The evacuation was shambolic. The fire service were called in to look at it. From that, we then recruited a couple of members as trade union safety reps. The reps on the ground were continuing to raise safety issues, which they done very well, very effectively. And through that, we recruited some more members to the SECC.
Scott has been our health and safety officer for many years, probably so many I can't remember, and I've worked with him for that many years as well. So we're both long-standing branch officers within the branch. He does a fantastic job as the health and safety officer, both within the whole corporate setting of the branch, but in particular within education services.
Stress, mental health and overwork have increased massively over the last 3, 4, 5 years. A lot of that in our view is down to obviously the public sector budget cuts. Staff are leaving public services, they're not being replaced, but services still need to be delivered. So the staff there have to carry the brunt or the extra workload.
I mean, Scott's role in introducing our No to Overwork campaign has been pivotal. It's really important because now as we face cuts and they're ongoing, then we know our members have been asked to do more work, with less people, and it causes all sorts of health problems. We see an increase in stress, and he has absolutely, championed that, and we are fully supportive and think it's a really great campaign. We've got behind that, and we raise those issues with management. If they're going to cut posts, we're going to say no to overwork. Not that our members will not work, but they're not going to do other people's work because it just increases stress levels. So as I say, it's a really good, strong campaign, and I think it's so worthwhile, and Scott has been instrumental in that campaign.
I mean, within our branch, we started a campaign about 3 years ago about saying no to overwork and basically saying, no, enough's enough. We produce campaign materials, sent it out to the members. We also run training courses in workplace stress awareness. And the campaign's still ongoing because the cuts are still ongoing. The residential care strike in 2014 was elderly in the elderly sector, and it was run about, it was changes to shifts, to shift patterns. And that's the main reason why the members went on strike, because of 12-hour shifts. We'd raised their concerns obviously about the safety issues with shifts, and a lot of research done about the effects of 12-hour shifts on the body, particularly in terms of cancers. And that was the issues we'd raised with social work directorate around that, about what research had they done, what had they carried out any, not just risk assessments, the quality impact assessments, because a lot of the members are women that work in the residential elderly sector. So that was some of the tools we used in terms of safety and well-being in terms of the residential sector strike.